Hello everyone and welcome back to the channel. Dr. Jamalvandi here. Today we're diving into a topic that is incredibly common, yet often surrounded by silence and confusion. Low libido or low sex drive. So many people experience a dip in their desire for sex at some point in their lives. And the big question they always have is this normal or is there something wrong with me? Today we're going to answer that. We'll break down the difference between a temporary slump and a true medical issue, explore the surprising physical and psychological causes, and most importantly, talk about the practical steps you can take to address it. So stick around because this is a conversation you don't want to miss. Low libido. When is it a medical problem? What is normal libido anyway? First things first, let's get one thing straight. There is no single normal level of sex drive. What is normal for one person might be completely different for another. Libido exists on a spectrum. Some people think about sex daily, others weekly, and for some a few times a month is perfectly satisfying. The key is what's normal for you. So the most important question isn't am I normal compared to others, but rather has there been a significant and persistent change in my own usual level of desire that is causing me distress? If the answer is yes, if you've noticed a marked decrease that's been bothering you for, say, several months, then it's worth paying attention to. This is what we in the medical community often call hypoactive sexual desire disorder or HSDD. But don't let that scary term worry you. It simply means a persistent lack of sexual fantasies and desire that cause you distress. It's also crucial to distinguish between libido, the desire for sex, and other sexual issues like erectile dysfunction or problems with orgasm. Those are related, but they are different. Today, we're focusing on the engine's spark, not the mechanics of the car itself. The red flags. When should you see a doctor? So, when does a low libido cross the line from a maybe I'm just stressed to I should probably talk to my doctor about this? Look for these red flags. It's sudden and unexplained. Your sex drive was at your normal level and then it just fell off a cliff for no obvious reason. It's persistent. It's been going on for more than a few months or it's not getting better. It's causing you distress or anxiety. This is a big one. You're worried about it. It's affecting your self-esteem or making you feel less connected to your partner. It's accompanied by other physical symptoms like unexpected weight gain or weight loss, hair loss, constant fatigue, changes in your skin, or changes in your menstrual cycle. It's affecting your relationship. It's becoming a source of conflict or distance with your partner. If you're nodding along to any of these, especially a few of them together, it's a very good idea to have a chat with your healthcare provider, the medical detective, uncovering the physical causes. Now let's put on our detective hats. Low libido is often a symptom, not the disease itself. It's like a check engine light on your car's dashboard. You need to find out what's triggering it. Let's start with the physical causes. The first is hormonal imbalances. Testosterone. I know what you're thinking. That's a male hormone. Well, yes, but it's crucial for libido in both men and women. In men, low testosterone is a classic cause. In women, testosterone, which is produced in the ovaries and adrenal glands, plays a key role in driving desire. Estrogen and progesterone. In women, fluctuations in these hormones can have a massive impact. Perimenopause, menopause, postpartum, and even certain times in your menstrual cycle can cause desire to plummet. Low estrogen can also lead to vaginal dryness, which can make sex uncomfortable, which then further decreases desire. It's a vicious cycle. Thyroid hormones. Your thyroid is your body's master metabolic controller. If it's underactive, hypothyroidism, you can feel sluggish, gain weight, and lose your sex drive. If it's overactive, hyperthyroidism, you can feel anxious and irritable, which also kills libido. A simple blood test can check this. Medications, the usual suspects. This is a huge one. So many common medications have libido killing side effects. Antidepressants, especially SSRIs, these are famous for this. They can blunt emotions and make it difficult to orgasm, which in turn reduce the motivation for sex. Birth control pills. For some women, hormonal contraception can lower free testosterone, directly impacting libido. Blood pressure medications. Beta blockers and others can cause fatigue and sometimes erectile dysfunction. Anti-anxiety meds and even some antihistamines can play a role. Important. Never ever stop taking a prescribed medication without talking to your doctors first. This is about starting a conversation, not making sudden changes. Underlying health conditions. Conditions like diabetes, which can affect blood vessels and nerves, heart disease, and even chronic pain conditions like arthritis can drain your energy and your libido. Obesity. This can affect hormone levels, self-image, and overall health. Sleep apnea. This is a sneaky one. If you're not getting restorative sleep because you stop breathing at night, your energy, mood, and hormones will be all over the place. High prolactin. This is a less common but important one. A hormone called prolactin, which is normally high in breastfeeding women, can be elevated due to certain medications or a small benign tumor in the pituitary gland, and it can suppress libido. The mind-body connection. Psychological and lifestyle causes. Our minds and bodies are not separate. What affects one affects the other. So let's talk about the mental and lifestyle factors. Mental health, stress. This is public enemy number one for libido. When you're in fight or flight mode, your body is focused on survival, not on reproduction. Cortisol, the stress hormone, is a libido killer. Anxiety and depression. These are major players. Depression doesn't just make you sad. It robs you of joy and interest in things you once loved, including sex. Anxiety can make it impossible to be present and relaxed enough for intimacy. Poor body image. If you don't feel good in your own skin, it's very hard to feel sexy and desire. Relationship issues. Lack of emotional connection, unresolved conflicts, poor communication, or trust issues are massive libido suppressors. You can't feel sexually open with someone you feel emotionally closed off from. Lifestyle factors. Lack of sleep. When you're exhausted, sleep almost always wins over sex. Alcohol and substance use. While a little alcohol might lower inhibitions, too much can depress the central nervous system and impair sexual function. Chronic use is a major factor. Diet and exercise. A poor diet can lead to low energy and poor health. On the flip side, regular moderate exercise is fantastic. It boosts mood, energy, and blood flow. But overtraining can have the opposite effect, exhausting your body and lowering hormone levels. The solutions and treatment pathways. Okay, we've diagnosed the problem. Now, what can we do about it? The good news is a lot. Treatment is all about addressing the root cause. Step 1. The doctor's visit. What to expect when you see your doctor? Be prepared to talk openly. They will likely take a detailed medical and sexual history. Ask about your stress levels, mood, and relationship. Perform a physical exam. Order blood tests to check hormone levels, testosterone, estrogen, thyroid, prolactin, iron levels, and vitamin D. Step 2. Addressing medical causes. If it's a thyroid issue, thyroid medication can be a game changer. If it's low testosterone and this is confirmed by blood tests, testosterone replacement therapy might be an option for both men and women. Though its use in women is considered off-label and require a careful discussion with a specialist. If it's a medication, your doctor might adjust the dose, switch you to a different one, or add another medication to counteract the side effects. Step 3. Lifestyle prescriptions. This is the part you have a lot of control over. Stress management. This is non-negotiable. Find what works for you. Mindfulness, meditation, yoga, walking in nature, or simply setting better boundaries. Prioritize sleep. Aim for 7 to 9 hours of quality sleep. Make your bedroom a sanctuary. Move your body. Find a form of exercise you enjoy. It doesn't have to be the gym, dancing, hiking, swimming all count. Eat a balanced diet. Focus on whole foods, lean proteins, healthy fats, and plenty of fruits and vegetables. Step 4. Psychological and relationship tools. Therapy. Individual therapy can be incredibly helpful for anxiety, depression, or past trauma. Couples counseling or sex therapy can help you and your partner rebuild intimacy, improve communication, and break out of negative cycles. Scheduled intimacy. This sounds unsexy, but it works. When desire is low, you can't wait for spontaneous desire to strike. You have to cultivate it. Schedule time for connection, which doesn't have to lead to sex. It could be a massage, a bath together, or just cuddling. This takes the pressure off. A special note on communication and patience. I want to take a moment to talk about something simple, yet incredibly difficult: communication. If you're in a relationship, talk to your partner. Don't let this become a silent. Talk to your partner. Don't let this become a silent, festering issue. Frame it as a we problem, not a you problem. Say something like, I've noticed my libido hasn't been what it used to be, and it's bothering me. I'm trying to figure it out, and I'd love your support. And finally, have patience with yourself. Your body and mind are not machines. Recovering your libido is a journey, not a quick fix. It requires compassion and time. So, to wrap it all up, low libido is a common issue. It becomes a medical problem when it's a persistent change from your personal normal and it's causing you distress. The causes are a complex mix of physical, psychological, and lifestyle factors. The path to a solution starts with a conversation with your doctor or to rule out underlying medical issues. and often involves a holistic approach looking at your stress, relationships, and daily habits. Looking at your stress, relationships, and daily habits. You are not broken. You are not alone in this. Understanding the why is the first and most powerful step toward finding a solution that works for you. If you found this video helpful, if it answered some of your questions, please give it a thumbs up and share it with someone who might need to see it. What other health topics would you like me to cover? Let me know in the comments below and ask me any question you have in the comments. And don't forget to subscribe and hit that notification bell so you don't miss your next episode. Until next time, take care of yourself. I'm Dr. Jamalvandi and I'll see you in the next video.